welcome to the first episode of the Blue Couch with Farah podcasts. We're starting off the episode with a series on preconception, counseling, and care. And to kick off the series, we have on the couch today a doctor, a senior registrar of the Obstetrics and Gynecology Department in Louth. Welcome, Dr. Adekonye.
Yeah, thank you. It's nice to be here.
So, preconception counseling and care. Not a lot of people know. They've never even heard the word preconception counseling. So, can you shed more light on what preconception counseling is all about?
Yeah, thank you for the question. Let me start by defining the word itself. Conception. Conception is the process by which a man and a woman come together, have intercourse, and get pregnant. That is what conception is. Then the preconception, and then you now add the word preconception counseling and care, meaning that, okay, what this word entails is the kind of care you provide for an individual or for a couple before they get pregnant, so that the outcome of the pregnancy will be optimal and will be beneficial to the baby. So that is what preconception counseling and care in its basic terms represents, or what it means. And it's an area that is growing up now in women's health, in the sense that we realize that along the line, some of the things that go wrong in pregnancy could have been prevented before a woman gets pregnant. And that defines what the concept of preconception counseling and care is all about.
Because it's like before the conception happens. Exactly, before conception happens. Because I've had cases of women suffering from preeclampsia, that's hypertension, and that's after pregnancy, and they don't even know what happened. They don't know the root cause of these things. These are part of the achievements, or those are part of the aim or the objectives preconception counseling and care is really focused on. To also break it down in details, it is a form of wide variety of things that can be done for an individual or for the couple, in the sense that, to start with, it is all about health education, health promotion, aiming for an optimal health for the woman and for the man. That is one of the major parts of preconception counseling and care. Another very important part is the part of planning for the family planning. You say you want to get pregnant, you want to have kids. How many do you have in mind? What years? How many years you want spaced between them? Family planning. You know, when you say family planning in Nigeria, is after contraception, contraceptives.
Okay.
So that's what most people
understand by family planning.
Few people know what preconception counseling is. Yes.
So the aspect of the family planning and contraception, we say them together, but they are not exactly the same thing. So the concept of family planning is that the couple deciding how the number of children they want to have, the spacing between the children, because there are some factors that come in if the spacing is not all right. So, and then how they want to arrange having the children. You need to consider so many things: economic factors, physical factors, psychological, psychosocial factors. All those things come in play. So that is what family planning entails, and that's part of the things preconception care can do for a couple. Another very vital aspect of preconception care is genetic counseling. Sometimes it even delves into why a couple may not get pregnant at the right time. I'm talking about infertility. So genetic counseling, genetic testing, those things can also come into preconception counseling and care. Then obviously the other aspect is managing women and men that have pre-existing conditions
that may prevent them to not even get pregnant, or may come in play when the pregnancy is ongoing. Then another vital aspect of preconception counseling is the psychosocial aspect, the psychological, where we talk about women's mental health, the health of the couple, mental health, psychological health of the couple. Those things also come in play. There's one I didn't mention, immunizations.
Really?
Yeah, immunizations is also part of it. Yeah, immunization, managing infectious diseases, all those things, they all form the conglomerate of preconception care. And it's something that, if done properly, if done very well, you are not going to be battling with complications of pregnancy. You are not dealing with, oh, this thing went wrong because this was not properly done. What you are dealing with is, oh, let's make sure it doesn't happen in the first place.
Yeah.
And as they say, prevention is better than cure.
Thank you very much, sir. So, doctor, you said that preconception counseling helps identify some of the risk factors that affect fertility in female and males. Can you elaborate on some of these risk factors for females, for women?
So for infertility, for us to understand risk factors for preconception counseling, we need to understand what causes infertility in the first place. So it has been simplified in such a way that we look at factors that are from the male, factors that are from the female, and factors that are from both of them. Now, for the male, there are some certain factors that can affect erection, ejaculation, sexual arousal. Those ones come in play. For the male, what you really need is for the sperm to be released. So anything that tends to affect all those things can cause a male factor infertility. Then for the females, it is varied, starting from the brain.
Wow.
Because everything starts from the brain. Everything about a human being is controlled by the brain. So the factors could originate from the brain itself. Factors can originate from the eggs. It can originate from the tubes. What we call tubes, in the female reproductive organ, there's what we call the uterus or the womb, and then it has tubes. So it's something like this.
Okay.
Yeah, the tubes are outstretched, tubes are outstretched, and at the end of the tubes is in very close contact with the ovaries or the eggs of the woman. So every month, that egg releases a smaller egg that's supposed to be fertilized by a sperm.
Okay.
So when the sperm cell is coming in, it passes through the womb and goes into that tube. So it is in that tube the sperm and the egg will meet, and then they will form a baby. So if anything tends to affect that tube, it can affect fertility. If anything affects that womb itself, it can affect fertility. The opening of the womb itself, what they call the cervix, if anything affects that also, it can affect fertility. If anything affects the ovaries, it can affect fertility. So it can vary from one individual to the other. But for us to understand the root causes of infertility, you need to look at the man, the woman, and both of them. And that's the reason why infertility, you can't manage infertility by just seeing a woman only.
Yes.
For all you know, the causes could be from the man. You can also manage by just seeing the man only. So most times, gynecologists manage the women, urologists manage the men. So we have based on what the condition is. But most cases of infertility are driven by women because of culture, religion, societal factors. So the woman will come in first. She will bring her husband along. So for gynecologists, we will do investigations or what we call tests for the woman to see. After we have taken our time to ask questions, examine the woman, and then we'll now do tests. For the man, we'll do the same thing. Ask questions, examine, and then do tests. Most times the test we do is to see the quality of sperm, number of sperm, whether they can come in as a root cause. And if we see anything wrong with those sperms, we now send the patient to see a urologist, which can help manage some of those cases. So in terms of things that make a woman at risk, it can be just about anything. and it can be as wide and varied as I explained.
So something you said it's, which is very true in our society. It's the woman that comes in that it bears the brunt of
The
issue of infertility. They say, oh, it's the woman's fault. And you raised something important. You said it could be the egg, it could be the uterus, it could be the tubes, it could be
all the way from the brain.
Exactly. So, and the brain, by I think some of the issues also with the brain are the hormones, right?
Yes.
So it could also be a hormonal thing, because people just generally feel that, they don't get to the root cause of the issue. They just, I'm not even, they don't even know if they are releasing any eggs at all, or they are seeing their period, and you say is the breakdown of the egg, that is the blood that you're seeing. So if I'm seeing blood, what happened to the egg? Do you understand? So a lot of women, a lot of couples need help understanding
what
the
it
root
is.
Causes of this.
To really understand what goes on, we need to understand the concept of the menstrual cycle. Yeah, a female that is still in the womb, has not come out yet, already is born with a certain number of eggs. The problem with it is that it's a finite number, and so many of them are going to die off. For example, at about 5 months, she has about 20 million in each ovary.
Wow.
By the time the child is born, it has reduced to like 1 million. And then by the time the menses starts, maybe around 11, 12 years of age, you have just about 30, 50,000 left. By the age of 35, what you have left is in the hundreds.
Wow.
So by the age of 50, 51, 50, maximum 55, they have all gone. And that is when you say a woman is menopausal. So naturally, it is designed that a lot of them die off. So what you are talking about here is that between the age of 11, 12, when the menses starts, till the age of 50 something, there is a finite number of eggs that come out, and they are meant to come out each month. The cycle differs from one woman to another, so you cannot compare yours to another woman's own. So what happens is that the normal cycle, the process that is supposed to starts from the brain. So when a woman gets into the age of seeing menses, that 11, 12, the process is triggered by the brain. And what the brain does is that it will send signal to another part of the brain, which is what we call the pituitary gland. Now, that part of the brain will now send signals, or what we call hormones. They are proteins, they are like chemicals that is released into the blood. That hormone will travel down in the ovary. It's going to stimulate the ovary that, it's time to start producing egg. So that first part of the stimulant, which is one of the hormones, I don't want to bore you with technical terms. So what it does is that it stimulates the ovary to release one of the about 30, 50,000 eggs that are remaining as at that time. Stimulate one to be released. So when it gets released, it gets picked up by that fallopian tube. And then it's going to roll and go to a part of the fallopian tube that has an open space, like an open area in the fallopian tube. Not open in the sense that it's like a tube with a wide space. So that is where it's waiting for a sperm cell. Now, what happens is that when the sexual intercourse happens, the sperm cells will get deposited in the vagina, but they are not picked up. They are usually picked up by the mouth of the womb, where they will swim through. Now, if a woman releases sperm, when a man releases sperm, about 5 to 7 males can be released at a go, and each male will contain the least amount you expect from WHO standards. From each male is 15 million. Wow. So you are talking millions of sperm cells. All you need is just one to fertilize the egg. And the processing is that if one can fertilize that egg, it gets sucked up through the cervix, goes to the fallopian tube to go and meet the egg in that open space in the fallopian tube. When they merge, conception happens. And just one is in. And the moment that one has entered, no other one is allowed in.
Yes, of course.
And they form a baby and they start dividing. In the process of division goes on and on and on. That egg will now roll into the womb where it will bury itself and grow as a baby. So that's what the cycle is all about. So now when we talk about the concept of normal cycle, that is what is expected to happen. But mind you, if that process does not happen, that egg is waiting for a sperm cell. It did not see a sperm. The egg is going to die off. But what has happened all that time is that that womb was readying itself for a pregnancy. It was getting ready for a fertilized egg to come, but it did not see anyone. In the process of it getting ready, the inner lining is going to grow.
Okay.
So it grows and grows. Just imagine you have a field of farmland,
Okay.
and it is a fertile farm. And that farm is expecting you to plant a seed, but you did not plant the seed. What happens? It's going to grow weeds.
Yes.
So that's what in essence happens. It's growing, it's expecting you for the seed to come in.
Yes.
But it didn't see a seed. So at the end of the cycle, when the egg is not fertilized, 14 days later, always exactly 14 days later, that egg that was not fertilized, along with the growth, overgrowth, is going to stop getting blood supply. Everything gets stopped. So the excess that has grown in anticipation of the womb of a pregnancy is the one that gets shed off. That process of shedding is menstruation.
Okay. That's the blood.
That's the blood that comes out. So it's the excess that grew, that was in anticipation, but because the process did not happen, the hormonal changes happen again. Is in anticipation for the next one that is coming.
Okay.
So the cycle is not the way we think about it. It's in the other way. That means the egg is supposed to be released first in anticipation. If that does not happen, 14 days later, the menses comes.
Yes.
You understand me? So then, at the end of that menses, that is the time that can vary. From the end of menses to the another time the egg comes in. It can vary from woman to woman. Some is 14 days, some is 15, some is 20 days. So in that time gap from when the menses ended till the time the egg is released can vary. But it's also possible a woman can shed that endometrium, that lining of the womb can be shed out, and an egg was not released before it. It's also a possibility, because I said these are chemicals that the brain releases. So misfiring of the chemicals can just cause the whole thing to grow, as if it's expecting an egg. Of it, an egg was not released. So there are cycles that happen that are not producing egg. We call them anovulatory cycles. Cycles that did not produce an egg.
There will still be a shedding.
There will be shedding. You will see blood coming out. In your opinion, you think she's menstruating, whereas she's not. So for us to confirm, we have ways of testing to know, was an egg released, was an egg not released. These are also things that we do as part of our work.
Okay, so I like how you have broken it down. So that means there could be problem with the tube. There are tube defects.
Yes.
There could be a problem with that mouth of the uterus that will pick up the
sperm. Yes.
There could be problem with the, like you said, misfiring of the chemicals.
Yes.
Is also
and it's a problem. There could be a problem in the ovary itself, not producing egg as it should.
Okay.
So sometimes the ovary may be dysfunctional, may not be working well. So what happens in cases like that is that ideally the chemicals that fire from the brain just need a small quantity to trigger it to produce an egg. If it happens that it triggers it with a small quantity, egg was not produced, the body senses it, it increases the dose. It will increase the dose. And a woman that has not seen menses, a menopausal woman that has stopped menstruating, the dose of the thing that is firing the ovary is usually high in them. And that's because that thing has been firing. It's not getting egg produced. So the value will keep going up. It's one of the ways we know that a woman has gone into menopause. So, but that firing chemical, we call it FSH. Ideally, the quantity you see at the beginning of menses not supposed to be more than 10. You understand me? Yeah. Just need little quantity to trigger egg production. But in a woman that is no longer menstruating, that the ovaries are not working, that thing can be as high as 40.
Wow.
Anything more than 40, you know that thing is firing, the ovary is not responding. That can also happen in a diseased ovary. Woman that has been exposed to maybe chemicals, radiation, or drugs, so drug abuse, drug substances can destroy the ovary.
Wow.
Or woman that has some form of cancer, chemotherapy, destroy the ovary. So the firing chemical is firing, it's not picking up. So it could be a problem with the ovary also. The tube, the commonest thing you see with the tube is infection. Yeah, if there is a form of infection within that womb in a young woman, that tube can get blocked.
Really?
Yes, it's exactly what they call it. It is a tube. So it has narrow part, it has wide part.
STDs?
Yes, STDs, for example.
Wow.
Yeah, some of these STDs can trigger up a form of infection that in the long run can block the tube. Or a woman that has had surgery, you understand me? Maybe had fibroid, had something else, or some surgery within the abdomen. So in the process of the surgery ongoing, the tube gets affected and tied off.
Wow.
So tubal issues. In fact, we realize that women that have had children before, is these tubal issues that's usually the commonest reason why they don't get pregnant a second time.
Wow.
Then the womb itself also. Some people don't even have a womb. Yeah, it's possible there might not even be a womb there. So in the first,
and they'll be somewhere and praying.
Exactly. So it's also possible there was even no womb. Some have more than one womb. In fact, in some women, it is 2 of everything they have.
Wow.
It's the process that went wrong while it was being formed. That it will form womb here, form womb here. So those things also come in play. So, and the active part inside will not be that much. So they are getting pregnant might be difficult. Some is a problem with the womb. And then the mouth of the womb itself. If the processes around the mouth don't allow for picking up of sperm is not going to go through. Because there are some certain ways that thing should be before a sperm can go in.
Wow.
So these factors all come in to why a woman cannot get pregnant.